Hi everyone, welcome back to my channel. In today's video, I will be talking about melasma. What is melasma? Why does this happen? What are the aggravating factors? What are the lifestyle changes that can prevent or reduce melasma? The creams available for melasma and the dermatology procedures for melasma. What is melasma? Melasma are the brown patches that happen on the cheeks, on the nose, on the upper lip. It can happen above the brows, and it is usually more common in women. What are the reasons or aggravating factors? The most common reason, of course, is sun exposure, excessive sun exposure, if somebody is not applying a sunscreen. And the second most common underlying reason could be hormonal changes. So when I say hormonal changes, it could be thyroid, melasma, or a lot of other pigmentation disorders are very common in people with thyroid disorders. The second hormonal issue could be consuming oral contraceptives, since contraceptive pills are also hormones. So a lot of people can develop melasma after using oral contraceptives. The third important reason could be pregnancy. So the hormonal changes that happen during pregnancy can also cause melasma, and in which case it is called cloasma. So these are the reasons, the hormonal changes and excessive sun exposure. And besides this, sometimes makeup can also trigger melasma, because makeup can irritate your skin and that can lead to a lot of pigmentation on the face, especially melasma. Now that we've known the aggravating factors and everything about melasma, I will tell you very quickly what is it that you can do, the lifestyle changes that can reduce or prevent melasma. The most important thing is sunscreen. The most important thing that you can do to prevent melasma, to reduce your melasma, is sunscreen. And by sunscreen, I mean physical blockers only. So physical sunscreens or mineral sunscreens that contain zinc oxide or titanium dioxide are the ones that offer a stronger and a longer sun protection. So that's what I will recommend, the most important thing that you can do to prevent your melasma. So a lot of times people are not very happy with the white cast of physical blockers, and in which case I would suggest something that contains iron oxide. Most of the tinted physical sunscreens or tinted mineral sunscreens contain iron oxide and zinc oxide both. Iron oxide has a lot of added advantage. It is going to camouflage, because of the peach tint, it is going to camouflage the melasma. Most physical sunscreens are low on chemicals, and which is why they're less irritating to the skin. But just in case you want to go ahead with the chemical sunscreens, remember to check the SPF and the PA rating of your sunscreen. The SPF, the sun protection factor, should be at least 40, and the PA rating of your sunscreen tells you about the protection that your sunscreen will offer against UVA rays. And PA rating of your sunscreen should be at least 3. It should be 3 plus. And 2 finger length is what you need to apply for the entire face and neck. Remember to apply your sunscreen even if you're not going out in the sun, even if it is windy or raining. I've already said a lot about the blue light from the devices, the laptops, the mobile lights, the tube lights, and the microwave lights can also cause a lot of photo damage. So I've already said a lot about the blue light from the devices and the damage that it can cause. So remember to apply your sunscreen even if you're not going out in the sun. And I would suggest a physical sunscreen. If the white cast is bothering you, you can go ahead with the tinted mineral sunscreens that contain iron oxide. They have a peachy tint, and they are the best for somebody who has a pigmentation issue like melasma. Now that I've told you everything about the sunscreens, there are certain oral medications also that are going to help you. The most important oral medications, of course, are antioxidants, something that contains a vitamin C, vitamin B, vitamin E. These are the things that can help you. Glutathione is also an antioxidant. It's an oral antioxidant, and glutathione also gives wonderful results. So that's another oral medication that you can do. And tranexamic acid. Tranexamic acid is available as tablets, as gels, as injections. And I've already said a lot about tranexamic acid on my Instagram videos, Instagram reels. So I've made a lot of videos on tranexamic acid. Just in case you're not following me on Instagram, my Instagram handle is Dadu Skin Clinic. And so tranexamic acid is the latest molecule for melasma. I'm not prescribing a lot of tranexamic acid oral tablets during COVID because it has a prothrombotic action, which means it has a blood clotting action, and which is why that's how we started using tranexamic acid. It was initially used by gynecologists and for patients who had they were complaining of menorrhagia, so to stop the excessive bleeding in gynac patients. And that's how we discovered that it has a significant role in patients with deep dermal vascular melasma. So tranexamic acid oral medications also work really well. And another oral medication that's going to help you are oral sunscreens. I've again done an Instagram reel on oral sunscreens. So if there is something that you want to know about oral sunscreens, this Instagram reel is available on my Instagram handle, which is Dadu Skin Clinic. And now, besides the oral medications, there are a lot of creams and gels that can help you. Vitamin C serums. There is the glycolic acid creams, kojic acid creams, tranexamic acid gels that can help you. And there are a lot of creams that are available in the market which I wouldn't recommend. There are OTC creams that contain steroids and hydroquinones that can reduce your pigmentation, but then they can, since they have steroids, they can cause a lot of damage. So I would suggest you do not apply any OTC products for melasma, and consult a dermatologist if you have this skin issue. Now, once you know about everything about the creams, the sunscreen, the oral medications that are available for melasma, what is it that the dermatology clinics can offer? So there are a lot of procedures that are available in dermatology clinics, and the most important one being chemical peels. There are different types of chemical peels, and the one that I suggest in my clinic is the Magic Blend. It is a cocktail of different ingredients, and this peel works really well in people with long-standing melasma, people with deep dermal melasma. We've seen amazing results. The second thing that I would suggest for melasma is Q-switch lasers. So Q-switch lasers, if done under the supervision of a qualified and experienced dermatologist, you can see very good results. There are injections also that are available for melasma, injections in the form of PRP or platelet-rich plasma therapy, hydration booster injections for melasma. There are injections that contain glutathione, or injections with vitamin C, injections with a lot of antioxidants, and there are a lot of other injections that can be done for melasma that can improve the condition. And besides this, there are procedures wherein we infuse cocktails of stem cells and skin lightening ingredients that are going to rejuvenate your skin. And for somebody who has a very mild melasma, these infusion of serums and cocktails can also help. People with mild to moderate melasma may also benefit from sequential peels, where one peel is applied after the other in the same session to enhance the results. I hope this was informative. If you have any queries on skin and hair, please write in the comment section and I will be happy to help. And if you are suffering from melasma and you've tried a lot of treatments, book an appointment with me. And for more such informative content on skin and hair, you can follow me on Instagram at Dadu Skin Clinic, and also subscribe to my YouTube channel. Stay safe.